was privileged to participate in the public policy group yesterday. I should mention that I'm presenting on behalf of the group, and in particular the chair, Craig Kessler. I don't know if you're here somewhere, but I'm actually presenting what you should be doing, perhaps. I think there are several points to bring forward. I will be brief, and I hope that this will generate some discussion. The group yesterday considered 4 key points. The first, what perspective should this group be taking? This is the North American Thrombosis Forum. North America consists of 3 countries, the United States, Mexico and Canada, and it does not seem feasible to try to tackle these all simultaneously. And to be pragmatic, we should focus on one region because public policy is so different in different countries. And thus we thought that focusing on the United States would be appropriate. The second issue that we considered was what should be the goals of this group. And this is rather a loose description, but I think what we decided was that our goal would be to influence public policy concerning an issue that is patient important. That's a key aspect. There's no point in focusing on something that doesn't matter to the people that we're actually trying to serve, and that represents an existing gap in care. And I think it's worth wordsmithing that and coming up with a clear goal so that we can reflect back on this as we move forward. So we've got the perspective, the goals. The third key issue is, if we're going to influence public policy, how are we going to have an impact? I'm no expert in public policy, and we'll come to that in a moment. There were certainly others in the group who had far greater expertise than I, but collectively we recognised the need to import some expertise. The suggestions that were made yesterday were to leverage existing structures such as the NCQA, the National Commission on Quality Assurance, and the NQA, National Quality Assurance. These are independent organisations that produce quality indicators and that have great influence over organisations such as Medicare, Medicaid and private insurers. And if it were possible, it's a lofty goal, but if it were possible to collaborate with, to influence, to infiltrate the NCQA or the NQA, we thought that would be a suitable approach. And I think I speak somewhat for myself here. I think that the North American Thrombosis Forum should be lofty in its goals and should make approaches in this direction. Finally then, with those 3 issues in mind, what are the next steps? I think the North American Thrombosis Forum should educate itself about the NCQA and the NQA, and I would propose that at the next meeting we invite 1 or 2 representatives from these organisations, if they're willing to educate us. I think we should, and this is the beauty of the North American Thrombosis Forum, we're not a bunch of docs or a bunch of pharmacists or a bunch of patients or a bunch of nurses. We're everything. We represent all those. And we should leverage the strengths in our group, and there's probably tons of expertise here. But one particular expertise, our pharmaceutical industry partners have experts in public policy and influencing public policy, so we should perhaps also invite them to speak to us. Having invited them, we should identify not just gaps that matter for patients, but gaps that matter for patients and that are currently not addressed by NCQA or NQA. Then the third aspect of this, having been educated as to how we're going to influence public policy through these folk, having identified what they're not currently doing, the North American Thrombosis Forum should create a position statement and then get to work with trying to incorporate that into these NCQA, NQA.